Unfolds. All right, welcome to our Friday update. We're going to go ahead and take off our masks so that you can more clearly hear us and see our lips moving. I'm Nikki Britton. I'm the health officer for the Berrien County Health Department. I'm joined by my colleagues here, Dr. Hamill from Spectrum Health Lakeland.
Nice
Good to see you. And Under Sheriff Chuck Hite.
Good afternoon.
Yeah. So we're really glad to be here with you again, talking more about COVID-19 and what's been happening in our community over the last week or so. Make sure you're staying informed and up to date. I'll start us off, just talk about some of the data trends.
Yeah.
We've seen some somewhat encouraging things this week. We're definitely seeing a flattening and almost a decrease in our hospital admissions for COVID positive. Yes. So that's really encouraging to see that. We're also seeing the percent of tests that come back positive that's remaining relatively flat and at lower levels than it was earlier in May. And we know we're doing more testing.
Lots more testing.
So that's really encouraging. Those are some important things that we've been watching. For those of you who are paying close attention to the data, you will see we've had more deaths in the last week or two, and some of those trends are going up a little bit. This is to be expected. We did have some higher rates of confirmed cases, especially amongst those who are at higher risk. As we had that increase in cases, you do expect there to be a little bit
lag.
Yeah, a few week lag in deaths as well. So I predict that within a week or two, we will see a flattening of that trend of COVID deaths.
And
so
we will.
On this front, that's looking good. There are some more variables, though, as more people are out and about. I know, especially with Memorial Day weekend and all the beautiful weather we had, there were a lot of people out and about, more people in our community. So we'll continue to see how that is impacting transmission for us. I do want to add, again, that the health department does have dashboards. So if you're looking for more of that dashboard and looking at some of the trends, you can find that on the county's website. For those of you that are following along with the governor's press conferences, there also was a statewide dashboard that was released earlier this week that can be found at MyStartMap. That's mystartmap.info. And we'll put this in the comments, a link to it. But there you can see regional data as well as some county level data. So a lot of it is similar to what we already have on our dashboard, but it's a different way to visualize it. And you can also look at other counties' information as well. So testing has been another big thing that we've heard of. There's been a lot of activity here local. The governor has talked a lot more about testing. Do you want to tell us a little bit about testing trends from Spectrum Health Lakeland's perspective?
Yeah, certainly. A couple things. Antibody testing is now available, has been available here this week. We use that a little differently than we use the antigen testing, the nasal swab. This is to make sure we know if you're immune or not whether you have the disease currently or not, but immune or not. That's available. Requires the doctor's signature. That's billed to insurance. It's not one you just walk in and get for free. It's a costly test, $45 to do that test. Not everybody needs it. In fact, we're seeing early on about 90% of the folks that want the test turn out negative. So you don't just come in and say, oh, I want a test and have your doctor order it. There needs to be a reason to have that test. If you think you've been sick and you're caring for somebody elderly, that's a good time to say, am I immune or not? If there are other risk factors, if you've been sick and haven't been able to get the antigen testing and at the end want to know, was that really COVID-19? If you wait 7 to 10 days, you'll make probably an antibody. We don't know how long that's going to last. It's not the kind of thing you can take that and say, well, I'm never going to get COVID-19 because of an antibody, but it is a good indicator whether you've just recently had the test. There's been other testing going. You know, we had we had the National Guard come by and do it. You want to talk a little bit about that? Was pretty exciting.
Yeah, so the National Guard was actually here this week as part of a statewide initiative. As we've all heard from the governor and state health department, there have been efforts to do more testing of vulnerable populations. One of those vulnerable populations is nursing home residents. So yesterday, there were 10 teams of 3 National Guard members that came to do testing in long-term care facilities, nursing homes in Berrien County. So I believe there were well over 500 tests that were specimens that were collected as part of that effort of residents and staff. So those will be transported to the lab here today. I think they're actually en route right now, and we'll have some results for that probably in a couple of days. It's an out-of-state lab that it's going to, so we don't know exactly what the turnaround time is.
Yeah, I think it's not going to be a day.
No.
See, we had the test. We could have done this. But it's a statewide effort, and I'll take statewide help. Anytime that help comes, that's perfectly fine, but it'll be a little longer to get those results back. And I expect we're going to see a little bump in cases because of all that testing. Every time you do massive testing, you see a few extra cases.
Absolutely.
But it's going to be helpful to know what the current prevalence in our vulnerable population of COVID is.
Yeah, and speaking of those nursing homes, so we do have plans. We've been doing lots of work in nursing homes already, between the health department and Spectrum Health Lakeland in partnership with each of those skilled nursing facilities and other types of long-term care facilities. So some of the things that we're really ramping up next week, because we do have more testing supplies that have been made available through the state of Michigan, through FEMA, but we're going to be doing some more spot surveillance in nursing homes starting next week, where every nursing home is going to have an allocation of certain tests that they'll be able to do when they have somebody that might be symptomatic. Maybe they suspect is infected and needs to be tested. So weekly there will be surveillance happening in the nursing homes of residents and staff, and we'll be able to get a really good picture on a regular basis what's going on. And we know that there is some linkage between what's going on in the community and what's going on in nursing homes, and we'll be able to better characterize that. So that, I think, is a real benefit for our community. And Undersheriff, I know you mentioned last Friday about how the National Guard was present and doing testing in the county jail, and then results came back early this week. Do you want to talk a little bit more about that?
So as we talked before, up until this point, we had a symptomatic approach to testing, and we appreciate the relationship of the health department and honestly the Spectrum Health Lakeland, who's helped with those tests that we've done and gotten back, very, very soon. The Michigan National Guard, in addition to the vulnerable, long-term care facilities, reached out to all the sheriffs across the state. Our region was this last Friday, so Friday morning, just like you mentioned, we had 2 3-person teams come in from the National Guard. It was a voluntary testing, so it's not something you can force on the inmates, but it was offered to the inmates. We had 95 inmates take advantage of it, which is about 64% of our population. Our population's at the lowest we've ever had in the jail. And we did have 22 staff members, take the test. So it took a while to get back, as you mentioned. There's a lot of testing going on. At the same weekend, Muskegon Heights had a mass testing. So it took a couple days extra, I think, to get them back. But we were very pleased. All those tests came back negative. But with our symptomatic approach, we have over time had 2 inmates that have come back positive based on looking at symptoms and that approach to the testing. One of them, by the time we got noticed that it was positive, was released already from jail. So we've worked closely with the health department into continuing the tracing and that. The other one was in our facility, had no local charges, and the out-of-state hold was released. So right now we don't have any confirmed cases in the jail, but we have had 2, and we'll continue the symptomatic approach. But like you mentioned, we appreciate the effort of the Michigan National Guard to bring that in for a one-day kind of snapshot and make that available to us.
Yeah, and it's worth noting in the jail, for those who may not know this, you have excellent isolation measures in place and screening processes so that if somebody and when somebody did pop up positive, you were able to then test the close contacts. Those were negative, so we were really able to prevent spread in the jail in those situations.
So the most recent one that was positive was already in isolation. As I mentioned, with our population down, we have the ability to do some isolation that we wouldn't normally have, in a normal, if our population was at its capacity. So we have had that. We've also added additional cleaning, work with the health department in our isolation protocols. We have a medical provider. WellPath is our medical provider by contract for the jail. So we worked very closely with them, with our staff. And another, the county's also hired some outside cleaning companies to come in and help in our high areas like the medical, high touch areas. So we've tried everything we can. And like I said, the ability to isolate right now is key to trying to keep that spread. Because we've seen across the country, the spread in correctional facilities has been great as well. So
those preventive efforts have definitely been paying off. So that's been good to see. Other things that I know have been happening in the area, there's just lots of reopening, lots more activity, other things that are going on. Some of it definitely through the executive order, more things have been open. Retail has been open throughout the state this week. There's a lot more workplaces that are just coming online. So the health department has been providing technical assistance to different workplaces, helping people understand what are some of those health and safety measures to be able to put in place, understanding what to do if somebody does come up positive in the workplace and how do we prevent that spread, but also what are the preventive measures you put in place beforehand so that when somebody does become ill, because it probably will happen, how do you make it so your whole team isn't out on quarantine or worse, sick? I know Spectrum Health has been doing some stuff around workplace support. You want to talk about that?
Yeah, we certainly are. We're an essential service, so we've been open for business this whole time, but as you know, curtailed a lot of services that we knew we couldn't curtail forever, that ultimately we had to reopen, and we're open and ready for you. Our census is, back to normal historic levels, sometimes a little higher than historic levels. And we've been really reassured in watching some of the statistics in the facility. If you wear PPE, if you're careful, you can protect yourself and not get sick. I mean, some of the early concern is just kind of like no way to avoid getting sick, in healthcare. We're all going to get it. Certainly some of the images that came out of China and Italy early reinforce that notion. But we have folks now that are on dedicated isolation units. And by the way, we have both a dedicated ICU isolation unit and a regular isolation unit where it is controlled. And we have certain staff that have volunteered and been assigned to those units. And we have had close to zero, as of a week ago, I think maybe still, zero transmissions to our staff within that unit. It's unbelievably reassuring. So we are doing our best to be safe. We are sanitizing and cleaning and isolating and doing everything we can to protect both our staff and folks that need health care to make it as safe as buying a loaf of bread. The minute you go out of your house and you're with somebody or somebody else, you have some risk because you don't know who's handled what, touched what. But if you keep your hands clean and you wear those masks and you keep social isolation, and if you come to Lakeland for health care, we'll do our very best to keep people safe, and it's working.
Right, and that's so important that people are seeking that medically necessary care, especially if they have any of the chronic conditions
it is very important.
That do increase that risk. When those are better controlled and you do have that better relationship, safer. You do have lower risk. And so it is really important to continue to seek that care. Here at the health department, we don't necessarily manage chronic conditions or provide primary care, but we do provide healthcare services, immunization, sexual health, tuberculosis, a lot of different things that we do. We're also re-engaging some of the services. We've maintained many of them at a minimum level over this period of time, but we're starting to increase that as well. So we are continuing to open back up if there are other services you need from the health department in Benton Harbor, Three Oaks, or Niles. Please call our offices for an appointment. Everything is by appointment only, but those services are reopening as well. I mean, to your point, there are certain things that you can put on pause for a while, but now it's been a long enough period of time. Things that need to be tended to. So make sure you're taking care of those things. We're all actively working from a very proactive approach to make sure that, as you said, it's as safe as buying a loaf of bread to come into our facilities. Okay, so I think we'll take some questions. Are there questions coming in?
Yes. So when can we expect things to open up? When will the governor open up our region fully?
Can you read the governor's mind?
I've tried.
You've tried?
It's not really working.
We've been guessing.
My crystal ball is just clear.
Yeah.
There's nothing in it. So your guess is as good as ours. So we do know the stay home, stay safe order has been extended until June 12th. But we've also been told and been seeing that there have been more, I don't want to say holes poked in it, but there's been more exceptions to the stay home, stay safe order that have been continuing. So with retail opening up, but by appointment only, so that poses a little bit of a different challenge for some of those retailers. But there are more options. There are more ways that people can go run errands and do things that they might not have been able to do. It becomes really important as we think about things opening up. What are we doing to really protect ourselves? How are we weighing some of that risk? So being in large groups versus small groups, being indoors versus outdoors, these are all things that everybody should be thinking about as stuff begins to open up.
I think the governor certainly is watching the data.
Yes.
And if those data trends continue, and we hope they will, we would anticipate more liberalization of some of those stay-at-home orders. On the other hand, if we see a big bump in cases after a holiday weekend, it suggests maybe we're not quite ready for that. So certainly, the things we're doing now to be safe, the social isolation, the hand washing, the mask, we'll keep doing those things because they will absolutely decrease the incidence of disease, and we will open faster if we behave better, I believe. So, we still need to be diligent, and the temptation, you've seen that around the community, we've seen that around, the temptation is you see things, images on TV of these 1,000 people that got together in a party. Well, okay, if they can do it, why can't we do it? Those things are not safe. Under any circumstance, those are not. And that's different than going to work and being careful at work and reopening a business. It's a totally different scenario, so please be safe. And if we all do that well, the governor will open things more quickly.
One of the reopenings, just to comment on too, is this week the Secretary of State, Michigan Secretary of State, did advise that this Monday, June 1st, all 131 branches will open, but it's appointment only. So it's for the essential things that you need to be done that can't be done online. So they'll be taking appointments, and that'll start on June 1st. The other thing, yesterday, the chair of the Berrien County Board of Commissioners, Mac Elliott, did extend the county state of emergency, but that's sometimes confusing. So that has nothing to do with the governor's stay-at-home order.
Right.
What it does is it extended it until June 19th, which is in line with the state of emergency at the state, and that really protects non-county employees and volunteers that are helping in this effort to give some liability protection there. Also allows us to continue to request resources. So the fact that the state of emergency in the county was extended doesn't mean things are bad. We've talked about the current trends, and really doesn't affect the stay-at-home order that's in place.
We need our share of resources, and that helps us through it.
We've done well with some PPE. There's still some that's needed, so we didn't feel we're in position to say we've got everything we need. So that was extended until June 19th.
Good.
Yeah, that's great.
There are some concerns about how residents might be taken care of right now in long-term care facilities. If visitors aren't allowed in, how is the virus getting into these facilities, and who's making sure that the staff working there are following proper PPE protocols?
That's a really good question. You want to tag team this one?
Yeah. So, that is really important, and very astute observation. If there's no visitors, how is the virus impacting residents? And the short answer is that staff who work in these facilities are those who are in the community as well as in the facility. So when we see a first case pop up in a resident, that is usually an indication that there might be an asymptomatic staff member out there. The world is a lot different in terms of PPE now than it was even a month ago, and I would say our facilities in Berrien County are much better prepared to follow all of those precautions that you mentioned that are reducing transmission risk.
No, it is you're exactly right. It's asymptomatic transmission, and it comes from people in the community that come to work. That's one of the reasons the governor wants people to stay home as long as possible. And, caring for the elderly is such up close and personal work. Yeah. You have your arms around people, helping them to a chair or to the bed or to the toilet, and often are having to feed them and hold their fluids. So it's very up close and personal. So even with a mask, we know protection is not 100%. We know that virus can still be aerosolized. It is really easy to have an environment in a nursing home situation where the resident that has it has contaminated the whole room, which of course puts the staff at risk, and we're doing everything we can to clean it. But around the country, in every state and every community, the transmission in nursing homes has been a problem. Right. And we are working hard and trying to learn from everybody else's experience, do what we can to make it as safe as possible. And I'm sure as a country we're going to learn some things about caring for the elderly, but it is a problem, and it comes from asymptomatic transmission or asymptomatic carriers.
And a couple other things just structurally to note about long-term care facilities. One, we know that a lot of people who do provide direct care to some of our most vulnerable populations, whether it's in home settings or in nursing home settings, a lot of them are essential workers in other fields as well. We've learned that some of our staff members, through contact tracing, things like that, they might work in a grocery store or have some other job as well. So we've been working with facilities to help really cohort staff, so they're working one essential job at a time to help minimize that risk. But that's something to keep in mind. The workforce there's a lot of complexity there. And I'll also mention the state of Michigan, a regulatory agency that oversees nursing homes. They have been present. They have been coming to different nursing homes, not necessarily as an indictment of you're not doing a good job.
Could be helpful.
Because the highest quality facilities are not immune to this.
No.
Having COVID-19 in a facility does not mean that was a bad facility or that they did anything wrong. But Laura has been coming in, that regulatory agency, to provide additional support, to make sure best practices are in place, and to really make sure those quality measures are there. And that has been helpful in our community as well as across the state.
We've heard reports from other parts of the country of a Kawasaki-like disease that has affected children. Have we seen any of that here in Berrien County?
I don't believe we have. I don't believe we've seen any cases.
Nope. And nationally, we've seen it in the communities and cities that have been hit really, really hard, where there's a very high incidence or infection rate with the disease, like New York City and Detroit. And even then, it's been a handful of cases. So that's not something we're seeing here locally.
Last week, the governor removed restrictions for elective procedures at hospital and healthcare facilities beginning May 29th, which is today. What does that look like here at Lakeland?
Well, we're ready for that. Anticipated that. Elective is a little bit of a gray term. It's a gray area. What might be elective for one individual might be urgent, so that's kind of not by procedure, but by circumstances within a patient. The governor, I think, was wise when they first came out with those restrictions to say, a doctor has the right to decide with a patient's patient conversation, is this urgent or is this elective? But this opens it up to those things that are just absolutely, truly elective. Probably if you're going to have a nasal surgery, that's mostly elective. Unless you can't breathe at night.
Right.
Then it's maybe mostly urgent. And those kinds of things have been debated back and forth. But this basically says, if you think you need it, go get it. Because I think the governor realizes that we're creating a safe environment to give health care.
Yeah, that's great.
One last question. How soon can employees go back to work after testing positive for COVID-19? Do they need to test negative or have an antibody test before being able to go back?
Yeah, that's a great question, and we're fielding that question or variations on that daily. So the return to work is all based, and just return to any normal activities upon infection or confirmation of illness, really has to follow a time-based strategy. So there is some guidance out there about test-based strategies. That is if there are completely unlimited testing supplies. That is not the situation we have here in Berrien County. Testing has opened up. We do not have the supplies or the person bandwidth, really, to provide negative tests for every single person who has been symptomatic.
And sometimes you have to do multiple negative tests.
Right.
It's not just one.
Right.
So it burns through them pretty quickly.
It does. So the CDC guidance, and there's a lot of research that supports this, is a time-based strategy. So that means we want to see at least 10 days have passed since symptom onset, and 3 days since symptoms have really resolved. No fever, extreme reduction in cough. There might be maybe a little bit of lingering symptom, but if you've been more than 10 days past your symptom onset and 72 hours fever-free, that's generally when you're cleared. There has been a lot of research that has gone into the viral shedding that happens after 10 days. It might be detectable, but it's not in any sort of infectious amount. So after that 10-day and the symptom resolution, that's when people can begin resuming their normal activities. So with that being our final question, I don't know if there are any last words.
Just one, as we've done each week, I like to point out some of what the nonprofits are doing, and obviously United Way is a big part of emergency management in our EOC. So the Senior Nutrition Services were able to deliver 175 10-pound produce bags and 5-pound dairy boxes to seniors throughout Berrien County. And then the neighbor partnership with the Southwest Michigan Community Action Center did a food distribution on Wednesday the 27th, and over 100 households were served. So as people are struggling with this, we're just thankful for the nonprofits we have in our communities to be able to provide these necessary items.
Yeah, absolutely. That's really important. Thank you. Anything you want to end with? All right. Well, we thank you all for being here, and we'll see you next week.